I want to start by talking about one of the biggest and most common mistakes I see in people over 70 when they try to stay active. What is it? It's that they still try to do the exact same exercises as when they were 40 years old. They see a workout on television or remember an old routine from their youth and think, I can do that. That's a good exercise. But what they may not realize is that after 60, and especially after 70, the rules of the game change. Our joints, having carried us for 7 decades, need more protection. Our bones are not as resilient as they once were, and our bodies need more time to recover and rebuild. Choosing the wrong exercise is not only ineffective, it can lead to pain, setbacks, and injuries that can steal away our motivation and our mobility. This is a critical component of managing your senior health with wisdom. So today we are going to clarify this. Our goal is not to train harder, but to train smarter. In this video, I will point out 3 common exercises that people over 70 should avoid, and I'll explain exactly why they can be risky. But more importantly, for each one of those, I will introduce a golden replacement exercise that you should do. Instead, a movement that is safer, often more effective, and perfectly suited for the body you have today. This is your handbook for updating your personal fitness rules for this wonderful stage of life. So please watch until the end, subscribe, and hit that notification bell so you don't miss out on these vital tips. 1. The leg strength. Swap. Let's begin with lower body strength. 2 of the most famous exercises for building strong legs are deep squats and lunges. And for young athletes or middle-aged adults with healthy joints, they are fantastic. However, for many people over 70, these movements can do more harm than good. The reason they are so risky is the immense pressure they place on the knee joint. When you perform a deep squat or a lunge, a tremendous amount of force is concentrated on the patellofemoral joint, the area behind your kneecap, and on the menisci, the C-shaped cartilage pads that act as shock absorbers in your knee. If you have any pre-existing osteoarthritis, which is incredibly common, this pressure can aggravate pain, accelerate cartilage wear, and cause significant inflammation. Furthermore, both movements, especially lunges, require a high degree of balance and stability. A moment of unsteadiness during a lunge can easily lead to a wobble or a fall, which is a risk we simply cannot afford to take. I remember my patient Robert, a 75-year-old retired mail carrier, who was determined to keep his legs strong. He remembered doing lunges in his younger years and decided to add them back into his routine. He told me, I was only doing a few in my living room, but my left knee just screamed at me. I pushed through it for a few days, thinking it was just muscle soreness. The result was a severely inflamed knee that put him on the sidelines for weeks, completely derailing his walking routine and leaving him frustrated and afraid to exercise at all. He was making a common mistake applying the rules of his 40-year-old body to his 75-year-old body. The golden replacement for deep squats and lunges is the chair squat, also known as the sit-to-stand. This is without a doubt the #1 most important exercise for functional senior health. It targets the exact same powerhouse muscles as a deep squat, your quadriceps, your hamstrings, and your glutes, but it does so in a completely safe and controlled range of motion. The chair provides a safety net, preventing you from going too low and putting excessive pressure on your knees. It allows you to build real-world strength for the most important daily movement, getting up and down. Here's how to perform it perfectly. You'll need a sturdy armless chair that won't slide. Sit on the front edge of the chair with your feet planted firmly on the floor about hip-width apart. Your heels should be slightly behind your knees. To ensure your legs do all the work, cross your arms over your chest. Engage your core muscles by gently pulling your belly button toward your spine. Now lean your torso slightly forward, keeping your back straight and your chest held high. From this position, push powerfully through your heels. Imagine you are trying to push the floor away from you as you squeeze your glutes to rise to a full standing position. Stand tall for a moment. Then, with full control, reverse the motion. Push your hips backward first, as if you are aiming for the chair, and slowly lower your body back down until you are gently seated. That controlled descent is just as important for building strength as standing up. Aim for a set of 8 to 12 repetitions. If that's too easy, you can slow down the lowering phase even more, counting to 4 as you descend. If it's too hard, start by placing a firm cushion on the chair to reduce the range of motion, or use your hands on your thighs to give yourself a gentle push. We've found a safe and effective way to build leg strength. Now let's talk about the core. So many people are making a classic and potentially harmful mistake when they try to flatten their stomach or strengthen their midsection. If you're still watching this video and ready to build your leg strength safely, please comment "Safe Squats" below. And if you haven't already, I encourage you to subscribe and turn on the bell so you don't miss any videos. 2. The core strength swap. Our second exercise to avoid is perhaps the most famous abdominal exercise of all time, the traditional crunch or sit-up. For decades, this was the go-to movement for anyone wanting a stronger core. However, we now understand that for seniors, it is a high-risk, low-reward exercise. The primary reason to avoid crunches is the immense strain they place on your neck and spine. The motion involves repeatedly flexing your spine and often requires you to pull on your head and neck to lift your shoulders off the floor. This can lead to significant neck pain and strain. More seriously, for anyone with osteoporosis or thinning bones, this forward flexion of the spine can increase the risk of a vertebral compression fracture. Furthermore, crunches put a great deal of pressure on the discs in your lower back. Beyond the risk, they are also not very effective. Crunches primarily work the most superficial abdominal muscle, the rectus abdominis, or six-pack muscle, while largely ignoring the deeper, more important stabilizing muscles of the core. I think of my patient Carol, a 71-year-old who was determined to improve her posture. She saw a video online of someone doing sit-ups and decided to give it a try. She told me I only did about 10 of them, and I could feel my neck straining the whole time. The next day, my lower back was so sore I could barely bend over to put on my socks. She was putting her spine at risk for very little functional benefit. The golden replacement for the crunch is the glute bridge. This exercise is far superior because it is performed while lying on your back in a supported position, making it completely safe for your neck and spine. More importantly, it strengthens the entire posterior chain, your glutes, hamstrings, and lower back muscles. A strong posterior chain is the true foundation of a healthy core, providing the stability and support your spine needs to stay pain-free. It's one of the best exercises for improving posture and reducing lower back pain, a major focus for senior health. Here is how you perform a perfect glute bridge. Lie on your back on a comfortable but firm surface, like a carpeted floor or a yoga mat. Bend your knees and place your feet flat on the floor, about hip width apart. Your heels should be close enough that you can just graze them with your fingertips. Let your arms rest by your sides, with your palms facing down. This is your starting position. Take a breath in. As you exhale, gently tilt your pelvis and press through your heels to lift your hips up toward the ceiling. The key is to squeeze your glute muscles. Imagine you are trying to hold a $100 bill between them. Lift your hips until your body forms a straight line from your shoulders to your knees. Be careful not to arch your back. Your glutes should be doing the work. Pause at the top and hold that squeeze for 2 or 3 seconds. Then inhale as you slowly and with control lower your hips back down to the floor, 1 vertebra at a time. Aim for a set of 10 to 15 repetitions. This exercise not only builds strength, but also helps to wake up glute muscles that often become dormant from too much sitting. It's a safe, powerful, and truly functional way to build the core strength that matters. Our core and legs are now on the right track. Let's move to the upper body. There's a gold standard gym exercise that many people think is essential, but it can be very risky for a senior's delicate shoulder joints. If you're ready to build a strong core without hurting your back, comment "strong core" below. And if you haven't already, I encourage you to subscribe and turn on the bell so you don't miss any videos. 3. The upper body strength. Swap. Our final exercise to avoid is the heavy overhead press, where you lift dumbbells or a barbell from your shoulders up over your head. This is a classic bodybuilding and gym movement for developing strong shoulders. However, for many adults over 70, it can be a high-risk activity. The reason is the complex anatomy of the shoulder joint. It is the most mobile joint in the body, but that mobility comes at the cost of stability. As we age, the tendons and ligaments like the rotator cuff can develop wear and tear. Pushing a heavy weight directly overhead can easily cause impingement, where the tendons get pinched in the narrow space of the shoulder joint, leading to inflammation, bursitis, or even a tear. Furthermore, for individuals with high blood pressure, holding your breath and straining to push a heavy weight overhead can cause a dangerous acute spike in blood pressure. The risk of injury simply outweighs the reward for most seniors. I remember my patient Frank, a 76-year-old who had recently joined a local gym. He saw younger members doing the overhead press and decided to try it with what he thought were light dumbbells. He told me, "I felt a sharp pinch in my right shoulder on the 3rd repetition. I stopped right away, but the damage was done." He ended up with a nagging rotator cuff injury that required physical therapy and limited his ability to do simple things, like reaching for a can on a shelf for months. The golden replacement for the risky overhead press is the simple, safe, and surprisingly effective wall push-up. This is what's known as a closed chain exercise, meaning your hands are fixed against a surface. This makes it inherently safer and more stable for the shoulder joint than open chain exercises like lifting free weights. The wall push-up strengthens the exact same muscle groups, your chest, shoulders, deltoids, and the back of your arms, triceps, without putting any downward compressive force on the delicate shoulder joint. Another huge benefit is that the difficulty is infinitely adjustable. You are in complete control. Here's how to do it. Stand facing a clear, solid wall about 2 feet away. Place your palms flat on the wall at about shoulder height, and make sure your hands are positioned slightly wider than your shoulders. Step your feet back a little so your body forms a single straight line from your head to your heels. Before you move, engage your core to keep your back from sagging. Now inhale as you slowly bend your elbows and lower your chest toward the wall. Go only as far as is comfortable. You should feel a nice stretch in your chest muscles. Pause for a moment. Then exhale as you powerfully push back through your palms to the starting position, straightening your arms. That's 1 repetition. Aim for a set of 10 to 15 reps. To make it easier, simply stand closer to the wall. To make it more challenging, step your feet further away from the wall. This simple adjustment allows you to progressively build strength at your own pace, making it a perfect exercise for lifelong senior health. Excellent, you now have a trio of the safest and most effective exercises to build and maintain full-body functional strength. Let's summarize what we've learned. If you're ready to build upper body strength, the smart and safe way comment Smart Strength below. And if you haven't already, I encourage you to subscribe and turn on the bell so you don't miss any videos. So today we have learned how to train smarter, not just harder. We've identified 3 common but risky exercises and replaced them with superior, safer alternatives. We learned to swap the potentially dangerous deep squats and lunges for the powerfully functional chair squat. We replaced the spine-stressing abdominal crunch with the far more effective and back-friendly glute bridge. And we traded the high-risk, heavy overhead press for the safe and adaptable wall push-up. By making these intelligent swaps, you are building the strength you need for daily life while protecting your precious joints and spine. This is the very definition of a wise and sustainable approach to fitness, and it is the key to excellent senior health. The most important message I want you to take away is that you must listen to your body and honor the changes that come with age. This isn't about giving up. It's about adapting with intelligence and respect for the body that has carried you this far. Please don't feel you need to be a fitness expert. Start with just one of these must-do exercises this week. Make it a habit. Feel the difference it makes. Every small, smart choice you make is a powerful step toward a future filled with more strength, more confidence, and more freedom. Thank you so much for joining me today. If you found this video insightful and helpful, please show your support by giving it a like. Please also share it with a friend or family member who could benefit from this safer approach to exercise. For more practical guides to staying strong and active, make sure to subscribe to the channel and hit that notification bell. And finally, I'd love to hear from you. Please drop a comment below and let me know which of these exercise swaps you are going to try first. Stay strong, stay smart, and I look forward to seeing you in our next video.